I just want to talk a little bit more about hypophosphatasia to start with, to give you some reference, and then I'm going to get into my story. Hypophosphatasia is a genetic metabolic bone and tooth disorder. People with this condition have low levels of the enzyme alkaline phosphatase, which often affects the development of bones and teeth. However, signs and symptoms vary very widely, and mild cases causing only dental abnormalities, where more severe types have life-threatening consequences, especially in the perinatal and infantile HPP. ALP can cause bones to not form or to form improperly. They can become weak or soft, causing skeletal deformities, fractures, premature tooth loss, and pain throughout many systems. Typically, the earlier HPP symptoms occur or are apparent, the more severe the condition. It's estimated that in its severest form, we have about 1 in every 100,000 live births. But the true number of how many people actually have HPP is really unknown. Diagnosis is generally made through x-rays and blood tests, and the disease is classified based on the age at which symptoms first appear. So there are 5 main types: odonto, perinatal, infantile, childhood, and then the adult form. Researchers understand HPP is a genetic condition of the tissue nonspecific alkaline phosphatase gene, which is, of course, part of their genetic makeup through their whole life. However, we don't know, based on that genetic coding, how severe the disease will be. We can't predict that at this time. So that's the end of my sciencey part. Luckily, there is quite a bit of research about HPP available now. I'm going to put in a little plug for Softbones Canada. If you go to www.softbonescanada.ca, you can find lots of information, and there's lots of other links as well that you'll find about the disease. What I want to speak to you about today is, as future doctors or medical professionals, or maybe patients, I want to talk about what patients face with rare disease, that kind of experience, and that long and winding road between symptoms, diagnosis, and then ultimately, hopefully, treatment. In my case, I was diagnosed with HPP for the first time as a child. I was about 3 years old, and I had lost some teeth without trauma, and they had some pretty gnarly roots. And so my dentist decided to send me to Western University in London, Ontario, to try to determine what was going on, because he recognized that this wasn't really normal. So hypophosphatasia was eventually determined to be the cause of these dental issues, but they also did many x-rays to look at my long bones, and it was determined that, it was probably just my teeth. And my parents and I were sent on our way with very little information. There was literally a post-it note in my dental record saying the word hypophosphatasia. But beyond that, nobody really followed up about it. And the rest of my childhood went relatively unremarkable where the disease is concerned. And I spent a good deal more time, in the dentist chair than many kids do. But aside from that, I think I grew up pretty normally. It wasn't until my 20s that I started having a great deal of body pain, headaches. And this is where the journey for my second diagnosis really began. So as part of my talk, I wanted to talk about what it's like to be a patient looking for answers. And my mom and I joke sometimes that you become a medical tourist. You spend all of your time and even some money visiting all these different doctors and hospitals and medical places. And I've seen rheumatologists, nephrologists, I've seen endocrinologists, I've seen geneticists, naturopathic doctors. I've even consulted a shaman. And, you start to wonder, am I losing my mind? And I realized over time that I was speaking to doctors, and they started to say things like, did you experience any trauma earlier in your, in your young age, and maybe any kind of abuse? And I started to realize that they were looking for a psychological reason for the pain. And this really could turn into a psychological issue, because you get so frustrated that nobody seems to be able to give you any answers. Many people on the rare disease highway never make it to their actual diagnosis because they get frustrated. They end up treating the symptoms, or they're misdiagnosed. And in the case of hypophosphatasia, lots of patients have been misdiagnosed with osteogenesis imperfecta, rickets, fibromyalgia, arthritis, and so on. In my case, after the birth of my son in 2008, I was 36 years old, and my pain level was pretty significant. And I knew that I needed to start investigating a little bit more. And I know all of you are doing your math there. Yes, I'm in my 49th year, so next year is a big year for me. So I started up the engines again and started looking for some answers. And I had been diagnosed with fibromyalgia, and it really didn't resonate with me. So I did see a rheumatologist, and I had a lot of hope that perhaps she could give me the answers. But I was disappointed after telling her, I used the word hypophosphatasia. Could this be related? And she really didn't take, a lot of interest in that. And after some testing, she said, yeah, you don't have fibromyalgia, but I don't know what you have. And then she said, yeah, there really isn't anything else I can do. I'm kind of the end of the line where weird things are concerned. And I can't tell you how devastating that is. It's like I was being broken up with, which happens a lot with rare diseases. I kind of joke that every time you meet with a new medical professional, it's like going on a blind date. And you want to look your best and say the right things because you really want to make a match. If you really want them to make you a priority. So to do that, you want to be interesting, but not super weird. You want to be needy, but like not too needy. And you want to be knowledgeable, but like not cocky because they're the doctor, right? I've been broken up with by a number of doctors. And the one doctor was an endocrinologist who specialized in bones and disorders of that nature. And she said, well, I don't really know what else I can do. And I said, please don't break up with me. And she laughed. And I said, look, I won't call you. I won't make appointments with you, but I just need to know that, if I need you, you're going to be there. And as a person with a rare disease, you kind of feel like you're on an island all by yourself, sending up all these signals and waiting for that day when someone's going to come along and recognize you and, and help you. And until then, you're kind of getting by with whatever resources might be on the island with you. People need hope. They need to know that someone is hearing them and acknowledging their struggle. So it is so important as medical professionals that the patient feels heard by you. While you may not know what to say, saying nothing is definitely not the best option. Taking those extra seconds to really look the patient in the eye, nod at the chart, and let them know that you hear them and connecting with them. I think that's my best piece of advice because they will feel cared for, cared about, and in turn, they're going to care about what you have to say and follow that treatment plan. So again, I think that relationship is so important. I have to say, I'm still a little bitter with that rheumatologist for not recognizing, hypophosphatasia when I said it to her, but I didn't stop. And it wasn't until 2013 that I started Google doctoring myself. I don't know if any of you've done that. I'm sure you all have. And, you put your symptoms in and then you wait and see what comes up. And I've almost died several times based on my Google results. But eventually I did come across something that resonated. And it wasn't just about fracturing with HPP, but it was about bone pain and muscle pain and fatigue. And there was a doctor, Dr. Michael White in St. Louis, who'd done a study, and there was a number. So one day on my lunch, just totally cold called this man, got in touch with his receptionist, and she said, oh, well, did you want to talk to him? I thought, sure. So what followed was something that honestly, I have to say was like a miracle. Not only did I have the right doctor, but he actually took the time to speak to me on the phone, listened to what I had to say, said, yeah, I think HPP probably is the reason that you're experiencing all these things. And so he gave me a list of tests and recommendations that I could give to my doctor. And I can't stress enough how life-altering this was for me. I later found out who Dr. White is and that he is one of the foremost experts on hypophosphatasia. And honestly, if I'd known what a big deal he was, I probably never would have called him. But I think that speaks to another problem with rare diseases and this whole process for patients to get to the doctors they need. It is riddled with obstacles. Generally, to speak to an expert, it takes a lot of referrals, it takes a lot of time. And especially in the more remote areas of Canada, it can take a lot of travel and money. So all of these things are barriers to actually get to a diagnosis and treatment. So fast forward to a simple blood test that revealed that my ALP level was well below normal. My number is 9. Adults should be somewhere between 40 and 120 units per liter. Then they did a urine test to check my PEA, or my pyroethanolamine level, and it's a substrate, and it was well above normal. So suddenly, I had hypophosphatasia again. I was really excited, to have a name and to know that this was the reason that all this was happening. It wasn't in my head. It wasn't because I exercised too much or not enough, or I, was stressed out. There was a legitimate reason for this. But unfortunately, that excitement was tempered by the fact that there was no treatment. And so there I am again, another barrier. So now what do I do? So I start searching the web, and luckily I came across a website called Canada Hypophosphatasia Contact. And at the time it was being run by Debbie Teifer and Marjorie Callan. And I was desperate to speak to someone. So I reached out, and Debbie became my lifeline. Shortly after meeting Debbie, she set up a call for anybody that she knew or was in touch with in Canada with HPP, and asked if we would like to grow the group and actually rename it to Softbones Canada, because she informed us that there was a need for HPP patients to lend their voice, because there had been a drug that had been created, an enzyme replacement drug that showed really positive results for HPP patients, but they needed to have the patients talk about, sort of the burden of their disease. And so I dove in completely naive when she asked if I wanted to be a director, and naive of the many, many hours of work and worry that would be involved in setting up the group and keeping things running. But that being said, it's been very worthwhile, and it's really helped me understand my disease and my situation, but also, how all of this works, even in terms of the drug and how it gets approved. So our goal at Softbones Canada has always been to educate, empower, and connect patients with HPP, so that nobody has to go through what we had all gone through, feeling alone, and that nobody really understands what it's like or what you need, and that you're just like one voice shouting out in this vast wilderness. So to be a patient organization takes a lot of research, and luckily Debbie was up for the job and took a lot of that on, heart, soul, and that keen brain of hers, and helped make sure that we were following all of the rules and regulations. But one of the biggest barriers, of course, is as a rare disease group, you have a very small, very limited number of people to draw from, and then also you have very limited funds. So for those of you who are familiar with hypophosphatasia, you'll know that in 2015, Canada approved the use of aspartase alpha, or Strensiq, which is an enzyme replacement therapy for patients with confirmed diagnosis of pediatric onset hypophosphatasia. This was the first, and still is the only, approved treatment for this ultra rare disease. So we've learned a lot about, as a patient group, about how drugs are made available in this country, the rigors that they have to go through in order to be approved for use, but and not to mention the agonizing process of standing on the sidelines while the government works with the pharmaceutical companies to try to hammer out a price. And this brings up another rare disease issue. The price of rare disease drugs is generally astronomical. This particular drug is about $1 million a year per patient. Canada is one of the few developed countries without a regulatory framework for orphan drugs. Orphan drugs are medications used for the treatment of rare or orphan diseases, which are defined by their low prevalence, so usually fewer than 1 in 2,000 people. And they need to have serious life-limiting, they usually have a serious life-limiting nature. So hypophosphatasia certainly fits that bill. Since my re-diagnosis, I've had a number of metatarsal fractures, and that's not uncommon for adults with HPP. So I've gotten to wear a very fashionable boot quite often, and I do get a little bit of sympathy, but otherwise people don't really know that I have anything. But I've had to ramp things up a little bit this past fall, because I started having some pretty severe pain in my hips and in my thighs, and x-rays were ordered and completed, but they really didn't reveal anything. And I remember standing in my GP's office, and he is a very knowledgeable man and a very kind man. And he knows me well, and he trusts me, and we have a good relationship. And he was closing the file and said, yeah, it didn't really reveal anything. And I just said, Dr. Graham, something is wrong. And within seconds, he had this laundry list of things that we were going to do. One of them was a bone scan. So I had a bone scan done, and it revealed that I have atypical stress fractures of the subtrochanteric cortex in both of my hips. So that confirmed, again, that I wasn't crazy, but it also tipped the scale so that I could get access to Strensiq, and I have started taking it. So the point of this story is that without a patient who is empowered to investigate their symptoms, without a doctor who listens and respects the patient's insight into their own body, I would not have been able to access this drug that hopefully will start to help me very soon. In closing, I just wanted to say again that people will need you not only to care for their medical needs, but to establish a relationship with them and care for them. They need to know that someone is hearing them and acknowledging their struggle. They are experts in their own bodies. They live there. So talk to them, ask them what's going on. The rare disease superhighway can be a very lonely place for patients. There are a lot of twists and frustrating turns, But with the right medical professionals along for the ride, the journey can lead to diagnosis and hopefully to treatment. So thank you so much for letting me talk. And I hope that there was something worthwhile that you can take away from my talk.